Good afternoon and welcome to UMedTV. My name is Kemal Erkan. Today is August 25th. We have another special guest today, Eugene Young. He's going to be with us. He's running for the Congress in upcoming primary against Sarah McBride and Colin Davis. So before we go any further, I'm going to let him in so then we can start our discussion, our conversation. Eugene, you just need to turn the camera on. And I think you are on mute. I can see him here, but he didn't. Eugene, are you able to hear us?
Okay. Okay, there we go. I had a little hiccup, but
we had a little hiccup right before this one, and I was not anticipating that. So how are you doing?
I am fantastic.
Good to know. And I started this YouTube channel right after pandemic, around the first year of pandemic. Our goal was to have another resource for our patients, and also with the employees who were working from home those times. And then this became something a little bit more than what we anticipated. So now we have this weekly updates, 2 p.m. with United Medical ACU updates, and then 3 p.m. I have Bariatric Friday with Dr. Kemal, as we are one of the bariatric programs in the state of Delaware. So it's just, I don't know if where it's going to go later on. So, but we so far enjoyed, and the channel grew a lot. We are probably close to 2.5 million views, and we'll keep growing that hopefully. So you are running for Congress, and then prior to that, you have to go through a primary. So, and I had Colin Davis. I think she was the first one for this series. We started this as a political series for 2024. And Sarah McBride, actually, she's been in the show for different reasons last year, earlier this year, I think 3 times or so. Now we are going to bring her as well. So I think a challenging part for this situation that you are going to be in is the primary. And actually, when I was watching the debates, the Republican debates the other day, I can see how they were kind of going after each other. But then once that's over, they have to be under one party and one leadership. So, and they have to be able to say hi to each other. So how do you see to overcome that issue for you?
Well, it's first and foremost, I want to thank you so much for having me. It is an absolute pleasure to be here. I feel like I feel pretty honored to be here. You interviewed quite a guest list, So I appreciate the opportunity to be here with you this afternoon. So I just want to first and foremost start out with that. But secondly, I saw a little bit of the Republican debates, but I think our state is a little bit different from the fact that in the Republican debates, you had people from all over the country, different places. Many of them may see and know each other, but it's a little bit different from Delaware, where it's quite likely you will bump into one of the other candidates at the local coffee shop. We're just so small of a state. And so that just makes it more unique. We being in a state with less than, I believe we just crossed the line over 1 million people not too long ago. It makes it very much a relationship-driven state. So I think we mind how we treat people here because of the fact that in many cases I may know you, your aunt, your mother, your grandparents, or I may
Right.
know your sibling. So it's just a very small, it's that small state kind of feel.
It is. I mean, Delaware is really small from that point. But
Yes.
now, uh, when we have these three individuals in front of us from any of the Democratic uh, people who are going to vote for you guys,
Mhm.
what would you say that would make you differentiate from everyone else?
So what I think differentiates me from the other candidates, and let's be very clear, I know the other candidates. I remember meeting Sarah and State Senator Sarah McBride in 2014 at an HRC event in New York. And I've met our treasurer in 2018, 19, when I was at the Metropolitan Wilmington Urban League. She stopped in. So very close, small community here in Delaware. But what I think differentiates me is my background. I have, for the last 20 years, I have been working diligently for this state in a variety of ways of and acts of service. It first started around 20 years ago, approximately 20 years ago, when I graduated from college. I went to University of Maryland, Baltimore County. I was lucky. I normally tell a joke right now and say I was there on the soccer scholarship, but it doesn't really work over Zoom right now because I'm tall. I'm like 6'7", 6'8", and so I got a basketball scholarship to UMBC, and I graduated with 2 degrees, one in information systems, the other in sociology. And upon graduating, I came back home to my community, worked with 2 close friends who are brothers, and I co-founded a nonprofit organization for children. And it was that time in working with those young people which opened me up to a variety of issues impacting and facing families in the city of Wilmington, Newcastle County, and state in general. And so I would see young people who were literally just hungry, families dealing with addiction. One of the young men in my organization was shot. I was in the emergency room with him that night. My friend, his mother, was killed that same night. And so there are all these variety of things, going to parent-teacher conferences years before I was actually a parent of my own. It informed me about the issues that families are facing throughout our state, whether it's from the educational perspective, whether it's from housing, whether it's from drug use, whether it's around reentry. And that led me into working as a state legislative aide in our General Assembly for a few years. I then had a quick stint where I worked for Mayor and now Senator Cory Booker. I took a lot of knowledge I learned from there, worked for Delaware Center for Justice, where I was an advocacy director, focused on issues around reentry, reform, helping to push legislation to allow juveniles to get proper expungements, working to make sure people are able to, even though you've committed a crime, if you've paid your fines, you've paid your fees, and you've done all times you're no longer on probation, helping to push legislation so people are able to vote. Many of these different things. And that led me into running for mayor of the city of Wilmington, came up about 234 votes short, who's counting. But it was an amazing opportunity for me to connect with a lot of community members. I co-founded another nonprofit organization around that time to help people to get engaged and involved in local community and government, where we had government 101 trainings, things of that nature. And which led me to civil rights organization, working for the Metropolitan Wilmington Urban League for 4 years, creating programs to help young people get involved and engaged.
If we were to kind of like look at the most important issues today, not just for Delaware, but for the entire country, and I try to kind of make my own list, not making the own list, but I actually re-ranked the list. So the economy, healthcare, education, crime, energy and climate issues, housing, infrastructure, immigration, and corporate social justice. And then every time I have someone, we have a guest, so I may just re-rank this based on what's happening. But what I wasn't used to, being in Delaware for 25 years, I moved here in December 1998 and never left Delaware. So I'm like a hardcore Delawarean.
So you chose to come here, which is something as well. I think it's something to be said when people can move anywhere and yet they still.
So not everyone comes to Delaware wants to stay as long as I do. I did, and I do love it. I mean, honestly, this is a great state. We have access to those big cities. If you want to be, if you want to be in Philly, it's only 30 minutes. If you want to go to DC or Baltimore, I don't know if you want to go to Baltimore these days, but you can go to New York in less than 3 hours. So it's a great place, but economy, like where I was gonna go with this, economy was never the top of the list for us in the last 25 years and in the last couple of years. So it's just now, especially this last 12 months, I see this as a biggest issue because as we have financial issues, economical issues, then everything else is actually it's going to come after that. But and this is just my perspective, I don't think we were used to this. Now, and I'm sure you see what I'm seeing, especially when we go to these supermarkets or the pharmacies, or if you go to the mall, like the cashiers, salespeople, they're like 70, 75 plus years old. Yeah. And I try to sometimes really, I don't do a lot of shopping, but when I go, I try to have some conversation without, hurting anyone's feelings, but I want to know why they have to still work. And the answer is because they have to pay their healthcare expenses. They have to pay their rent or mortgage and other, utility expenses. Now, I think we have the biggest hit in the last 2 years. And it's not just United States, it's global. But this is a huge issue. Now, from your experience and what you have done with your current position, which you have a lot of relevant experience, and I do believe that you are, and also you are young. That's the other thing I want to talk to you about later on. But young, but you have at least 20 years experience in any of these. So how do you think we can actually overcome this issue that we are having? Every family, every household is having these issues these days. And I think I just have a feeling that it's not gonna get better. But how do you think we can fight with the economy?
Yeah, so you brought up a variety of different touch points in regards to our economy and what's going on in our country right now. Unfortunately, you are right. I was just speaking to someone a couple days ago, and I had an 80-year-old woman that I saw still making Lyft and Uber Eats deliveries. This is coming more of the common, more of the same, because we have so many families within our country that are priced out. And I'm priced out from a variety of different perspectives, whether that is the three big ones are healthcare, housing, and education. Those being certainly the top three. I see it in housing right now in my current position. We have people up and down the state that are struggling to find spaces to live, even while having full-time jobs, right? If you go, this is obviously you see some of this in Newcastle County, but it's starting to certainly creep up in areas of Kent and Sussex, where the housing wage, I oftentimes bring up to people, the housing wage just to afford a 1-bedroom, 1-bath fair market rate apartment, you have to be making $16.15 per hour in Sussex County. In Kent County, you have to be making $18.92, and in Newcastle County, it's around $23.56. So what does that mean? That means in many cases, the person that graduates from college, that comes back home to the community in which they grew up in, there are many cases going to be priced out of living space or being able to find a place to live. one of the other issues that kind of compounds housing. And it's interesting that you brought up this aspect of being moving here and still loving it here. My family came here on my maternal side. My father, paternal side, is from Chester, Pennsylvania. He was in the Air Force. My late father was in the Air Force and was a machinist for Boeing. My mother's side, maternal side, they've been in Wilmington in particular since 1919. My great-grandmother moved up here from Georgia. Great-grandfather moved up here from South Carolina. He was 24 in 1919. She was around 19. And they lived here and grew their family. They were able to have children that ended up getting different jobs, whether it was with GM, Chrysler, whether it was my mother, who was a teacher for 30 some odd years, or family members that may have worked for the city or state, or DuPont at the time. Unfortunately, we're in a situation right now where if that same situation were to occur today, those same type of jobs would not be available. And you would find people having to resort to Lyft, Uber, and other ways of trying to find a living. And because of the fact that we're here in Delaware, and this is crazy for me to say as a born and raised Delawarean, everyone wants to move to Delaware, which is crazy for me to think of as a Delawarean, but everyone wants to move to Delaware. If there's a Forbes magazine article from March that talks about us as being one of the top 10 importing states in the country. And certainly in this area of the East Coast, and our neighbors are part of the top 10 exporting from exporting states such as New York and New Jersey. So what happens is you have so many people moving in. 60% of all the homes in Delaware are single family detached. If you go to Kent and Sussex, it turns to 80 to 85%. So what does this all mean? So this means that if you have a child, as I spoke with two, 3 years ago when I spoke to Senator Lopez, he said a line to me, retired senator. He said, if my child comes back from college, they're not going to be able to live in the same community which they grew up in because they're priced out. If I and my wife were coming in the same community, we would be priced out. We would not be able to live in the same area. And so the way I look at this from this congressional race is we need to the state is now coming off this island. The state is doing an amazing job. Our governor put $122 million towards housing. But I also recognize the fact that our federal government has to get off the sidelines when it comes to housing. Our federal government has to get off the sidelines when it comes to making sure there's universal coverage in healthcare for all Americans. These are things that we need to push, promote, certainly in DC.
So one of the topics that you mentioned, which was part of my 9-item list, healthcare. And, being in private business for me, understanding the power of policymakers and being in the Congress would be one of those, or being a senator, or even if in the state level is the same. It's extremely important for people like us to know what our politicians really do for us. And one of the things that we know is you guys are the lawmakers in those positions. And that's one of the reasons that we have our specific interest in politics, is because we want to make sure that we are able to voice out our opinions and also our issues. And so far, my experience with our politicians here is all decent. There may be some exceptions, but I would say 95% decent. And all good people, and they all try to do good things. And as we have more conversations, one thing that is clear to me is when we are engaged from the small business, mid-sized business, or healthcare experts standpoint, usually that's a little bit late. And I know healthcare is one of the biggest ticket item in the budget for state and for federal governments, and also it's kind of like a little bit out of control in terms of our spendings and the way that it's being, different fee schedules, different facilities have, as you may know, hospitals are charging for the same service 6, 7, 8 times more, and they get paid. They are getting paid, and then they're nonprofit, But here, me on this private business, I have to deal with 1/6 or 1/7 of the income that they are making and still provide the same business, same service. So healthcare is one of our, it's going to be always one of our main focus. And what I want to kind of elaborate with an example so that you can kind of understand one of the main issues. And I can give you like 2-3 different recent examples, but this understanding of the insurance system is, I think, one of the problems that I see in, including myself until 2012. For example, I did not know that when you have Highmark or Aetna or Cigna, any of the commercial insurances, I thought you were insured by them. So there's this term called fully insured patients, and that is the actual Highmark or Aetna. I just, since I said the name, I have to say the others. I'm not picking on one. It's all any commercial insurance.
I understand completely.
They also listen, so sometimes they yell at me. So I'm not naming one, but all commercial insurances, their portion of the fully insured patients, where they actually risk the financial risk, they have the financial risk. That's only 22 to 25%. So rest of it, their income and their business comes from self-funded plans administrations, and that's what we call third-party administrators. So why am I giving you this background first? So for example, Senator Townsend, he's a great guy. We do like him a lot. He was with us at least 4 times, and he'll probably be back several more times. And he started this, one of the bills that they had, primary care support bill. So intention was great because they want all commercial insurance to pay what minimum Medicare is paying, and then just give like 2 or 3 years time frame to catch up. Because we were like 25% lower than Medicare fee schedule. So when I started this business, Medicare fee schedule was the threshold. It wasn't the benchmark. It wasn't the ceiling. Now it became the ceiling. So it's like, oh, if you get to the, can we get to that? Versus our contract used to be Medicare plus Medicare 125% of Medicare or 130% of Medicare. Now we are like 85, 75% of Medicare. So this Townsend bill fixed this issue. Great, right? So that's why we love him. But guess what? When it's written and the legislation, the way that it's regulations we have in the state, which it is true for other states, it only covers the fully insured patients. So if I have a self-funded plan, like state of Delaware is one of those, we have from United Medical ACO, we have about 5,500 state of Delaware employees that I can identify on our Highmark list, for example. So it's a big number. But then when these things are coming into the picture, like, oh, you have to pay them, it's only for fully insured one, not other plans. So then that leaves 80% of the business out, right? So if you think about it, we are mainly primary care. I mean, there are 22 other specialties, but when politician, state official, or anyone who's in these positions, when they're trying to help us, they really sometimes miss the goal. The intention, good intention is, yes, I'm going to help you, but then once you look into the system and the dynamics of the health insurances, it's not an insurance, it's an administration of the third party. So now when they think they're helping us, which is great, it's really affecting only 20% of our business, but we still have to do the work that's being standardized for everyone at the 100%. So this was an example that it just, we have been dealing with this in the last couple of years, and Brian actually did fix this problem with, or they're bringing up this issue again. It's great. Again, we are appreciating all these. But what I'm trying to ask you is, when do you think, how do you think we can change this approach, the attitude to private businesses, private practices, for-profit practices, so that we can actually have a better control on healthcare expenditures. Do you think we can change, or do you have a different plan, or what would be your perspective of that?
I would say that I appreciate very much your insight in regards to issues of healthcare and also how it impacts your business. And also, it's always good to see businesses, organizations, and entities working with our legislature in order to get things done. And with working with Majority Leader Townsend, I mean, I'm certainly understand. He certainly understands these issues and serious about getting things done. So I would say this: we have to do something about healthcare. Full stop. We have. I was just speaking with a small business owner today, and he was telling me that he has two incredible examples that popped out. One was he has 10 employees, and 10 employees that he covers through healthcare. And but he said, I would be able to afford 11, maybe 12, but certainly 11 if I did not have such high cost for because that 11th would pay for is what essentially pays for the other employees, the healthcare costs of all the other employees that we have. And it was also interesting that he spoke about this fact that he had so many, he recently put out a job application in all the different job search sites around the world, different spots around the world for remote work. And he made a point, he said, I never received a resume or interest from someone from the US because of that need for healthcare. And so most of the people that apply will come from the UK, they'll come from Germany, they'll come from other countries, Canada, but they won't, I can't find anyone in the US because obviously it's the need of insurance to be tied to. And so for me, I recognize that, when it comes to healthcare coverage, this is one of the biggest issues that bankrupts families. 60% of all people that file for bankruptcy file because of healthcare related costs. Also recognize the fact that we need to become better at giving quality of care earlier and better to meet the needs of the families in which live here in our state and throughout our nation for that matter. It's interesting that the CDC put out a report that the greatest cause of heart disease in Delaware, the greatest cause of death in Delaware is heart disease. And this is one of those kind of things where if someone does not have such high rates so that they can go to the doctor, so they can get better checkups, so they're not using the emergency room as their meeting with their primary care physician, it will provide more of an opportunity for people to have better coverage, better healthcare results, and it will actually essentially save lives in our state and also the nation as abroad at large. And so for me, I think that some type of universal coverage is going to be critical and important, whether we start out with a single payer. But I just think that that's the direction we need to go in. But I recognize one of the points that you brought up is we have to become better at administratively getting these programs and processes done. And that's something that's always been kind of hit up against government is how does government get some things done? It's too big. It can't get things done. I think our government has shown that it can, but we need to double down and make sure we're providing the best service possible.
So, and again, anyone can say whatever they want to say. So we do have an agenda. So, right. Mm-hmm. So not just for this meeting, but in life, in business. Yes. So I am okay with the fair competition. If everything is fair, and then if I have to do X, Y, Z, and then they have to do the same, and we get paid the same, I'm okay.
Right.
So, for small businesses like us, having a billboard on 95 is a big deal.
Yeah.
So, and I have one on 95 for our surgery center, and that's a big line item for me. So, because it's It's almost $6,000 a month.
Absolutely.
I'm going to tell you why I'm saying this. So it's a really important thing for me, right? So I have to really think about it. Can we afford it? Can we do this? Can we do that? And right before my billboard, there is this tail. Yeah, you probably see this from your office.
Yes, yes, I know exactly. I've
This
seen
is a
that.
nonprofit spending $6,000 a month. And not only that, they update that every month. I cannot afford updating it every month, so because they charge you like $1,200 every time they change that.
Hmm.
And yet they have to get paid a lot more for the same outpatient services that we do. And this is not limited to Christian Health, any hospital system in Delaware. Now, I have to build a primary care office. My one of our new locations is 600 Delaware Avenue. So it's
Yeah,
So
yeah. It used to be the
it's a bar. It
cut.
was a spa.
Yeah, it was just was it Chow? Or it was, yes, it used to
Well,
be a
it
salon.
was a spa first. Like the last time it was a spa, and before that it was a really famous, apparently, bar.
Bar,
Irish
yes,
bar.
and then it was a bar. Yes, correct,
Yeah.
correct.
And everyone remembers, as soon as I tell them the building, they're, oh, we used to go there for drinks. So I'm like, now you have to come there for primary care needs. So just, I want you to kind of process this with me. And because I also want to kind of give you some perspective of real healthcare issues. So I am now going to bring primary care patients to the city.
Mhm.
We have to be kind of careful where we picked. Like the place was, if it was 3 more blocks on the east side, I couldn't probably have a primary care office there. It's in a really good location. I love that building. And our budgeted cost for the renovation, the projected was $200,000 and ended up spending $400,000. These are big numbers for us. But if you now take this office and then go to 202, I think it's called Avenue, the new Christianity building, something there. This giant outpatient center, minimum cost, the minimum they spend 5-6 times at least for the unit cost, because I know how much, how much, like I can buy this door for $100 and the same door is also for $700. So we want to kind of keep certain quality, certain standard, but we can go for the highest end. So now I have this giant building structure, huge, so expensive, and it's not relevant, and it's nonprofit, right? So, and it's being paid at a higher level. It's spending more, and it's paying more for their people because they can make more money. So now I have to compete against this giant. And not, again, it's not limited to Christiana. Now, if I go out of business from the private practice side and everyone joins the hospital systems, then there's no alternative, or there's no better or efficient ways to lower the cost of healthcare. And that's why I'm actually spending a little bit more than what I was on spitting on this topic. So from your experience, like I want to kind of maybe get some more meats and the potatoes of the like what you would be able to do, like, or did you, maybe you didn't like you just started this. I don't know how long you were thinking about getting into this, running for the primary. So do you have a really good understanding of healthcare to fix the issue that we have today?
So I have, my background in healthcare is certainly not as extensive as yours, but certainly understanding from my purview, the different purviews I've had, of the importance of healthcare related costs, the importance of quality healthcare. You know, I run a nonprofit organization where we had to provide coverage and have serious conversations about that, of money coming in versus money going out. I've run an organization. Even my role now, I think what most people don't know is that the Delaware State Housing Authority, we are a part of government, but we are not officially of state government, meaning the employees of the Delaware State Housing Authority They are employees of the Delaware State Housing Authority, not the state of Delaware. So we have to manage healthcare-related costs at DSHA. We have to manage making sure that people are able to, as they retire, they're still able to, we have enough money to cover benefits as people go into their later years of retirement life. So these are conversations that I've had oftentimes in my job, in my workplace, just dealing with some of the needs of the people within the agency, and then also from just the small business and the conversations I have with people within the community. I would say this, but to your greater point about businesses and smaller businesses kind of being eaten up, that I would say that can be seen in a wide array of areas. I would even say outside of healthcare, as the small mom and pop shop, how they feel about Walmart, as the local book. There's a local bookstore on right on Philadelphia Pike, right around the Food Line that I've gone to a couple times, and ask her about what Amazon Prime in their books does to her bookstore, and how it gobbles many up. So these are larger conversations around economics, including healthcare, that certainly need to be addressed and dealt with moving forward.
Well, thank you. And so now what I was mentioning in the beginning, so this, I actually didn't know the term, so I'm gonna, is it gerontocracy? Gerontocracy?
Gerontocracy.
Gerontocracy. So when we were prepping a couple of things yesterday with Sean, I'm like, I was going to use geriatric, and then as we were just looking at a couple of the articles, this term is used. So I'm like, oh, okay, so this is kind of like already labeled. Now, I was watching again the Republican debate, and the person who's kind of closer to your age, I'm going to try to not mess up his name, his last name especially, Vivek Ramaswamy. So Vivek. We actually also invited him, and he did say he's going to join us, but I don't know when that's going to be. We are going to probably confirm that in the next couple of weeks. Although now he may be a little bit too popular, so I don't know. Hard. I don't know if they're going to kind of force him to come here. But interesting part is our people who are running for the office and other people are decision makers at the Senate and Congress level, and you look at them, and like the age is like it's almost insane. So, our current president is maybe planning to run for a second term, and he's going to be like 80-some years old, 83 now, right? He's going to be 83, and next year it's going to be more. So. My dad actually is going to be 83 next year, so he's 82.
God bless you, and God bless him. Absolutely.
Thank you. And he's in a really good shape. So I hope Joe Biden probably is not watching it anyway, so we can kind of talk about him. So my dad, although they're same age, he's at least like maybe 15 years younger than, like, he acts and do things like 15 years younger than the way that probably Joe Biden is, what we see so far with Joe Biden. And I'm concerned about those. I'm concerned about someone like Donald Trump also running for, he's 78, next year's going to be 79. So now United Medical have leadership here. Our oldest person is under 60 in the leadership. I'm 49. So if let's say if I have to hire someone in the leadership, and I'm going to say this, I don't know if I would hire someone over 65 years old for those positions. So, but now we are looking at 80 years old, like 75, 79, 83. It's pretty crazy, and they are willing to do it. So that's also really interesting. So. And also, like, one of the maybe most popular presidents who was young is sitting at home, Barack Obama. Like, he could actually come back and run for the third term. Like, he doesn't want to do it. It's interesting. So Now, having people like you running for these offices, because yes, you are young, but we are not young in terms of our experience, right? Like I mean, a bit older than you are, but like the 20, 25 years already, we build professional foundation. So, we can do this. And the way that they were kind of treating him, this Vivek Ramaswamy, I have it in writing.
I think you're getting pretty good at it. You give yourself
So I have to
credit.
practice a little bit more. So, like, if he was not qualified for this position, but like just from the Republican side, I can see he probably did the best job in that debate, and he has done so much in his personal and business life, so that he's qualified. So, why do you think we have to choose from old to the oldest? Kind of like, why we don't have new choices? Like, do you think that's going to be the new norm?
So I think we're going to start getting more people that want to get involved and engaged in the process. I also recognize the fact that I think it's always a good thing to have more people involved, more people engaged in the process. So more people running is a good thing. It's a good thing for the state. I love going to a la carte places. I love breakfast food, so going to places like that is amazing for me. Love eggs. So being able to say, to debate the ideas or to talk about different policy and how it's going to impact the people of the state, or as a citizen, how it's going to impact me, I don't think it's a bad thing. I think it provides an opportunity for me to hear different voices and to make a best decision for me and my family, as my wife would make her decision for me and the family as well.
I think my concern is more about their capability of doing the job requirement of that job. Like that, my dad was the reason I was talking about him. We were on a vacation together, and again, he's in good shape, but I can't see him doing a full-time job, or he's not willing to do it either. But he has to rest, like, he has to take small naps. I mean, he's not able to do it. So, if there are certain requirements that we have in law that says like, okay, you can sell certain things if you are if you are over certain age, or you can do certain transactions if you are X age. So I don't know if they are able to do this and keep up with the requirements from the position. That's because we need the most. Like I rather want you to be the president than.
No, don't put that on me. Don't put that. I would never, ever want to be the president of the United States.
Seriously though, like because then I can ask you to work 18 hours a day, because that job requires that, right? So that's why I'm kind of concerned about it. But I understand that you can probably just.
So I would say, but I would say this. I would say, to your point, two things. One is that one thing where so many people are able to run for office that I think is not enough expressed and talked about is the fact that, our baby boomer generation is the wealthiest generation right now in the United States. Point blank, period. They are the wealthiest generation. We have baby boomers flooding into Sussex County and areas in Middletown, Odessa, and Townsend. I know two that came, my in-laws, so God bless them, and thank you. But many of them have said resources and time to run. And so what you're seeing is also the fact that because running takes time, it takes money, it takes a network. And so if you're of said age and you have said resources, it allows you to be able to do those things. And secondly, what I also recognize is the fact that when I look at someone running, I look at what they're able to do as them as an individual. My wife's grandfather passed away earlier this year. He passed away living in a little townhome in the Bronx at 103 with his all his wits about to the very end. So I can't, it would be hard for me to say you cannot do after said age. I think it's meant for the people to decide who best is going to serve me, whether they're 99 or whether they're 49 or 29.
And I know it's we have to kind of be careful with this discussion because you are working with the oldest presidents, so right, so you are in his party, so I understand you, and we'll have an off-the-record conversation at the new primary care office. Now,
okay.
One other thing that I want, and I hope that we can have you back in 2024 before the primaries again.
I would love to.
A lot of other questions, but one of the things that also is kind of interesting these days, and in fact, I'm going to make a special trip with Sean to Philly. Some of the videos that we see, drug related, like drug kind of like crime related videos, and the reason I'm going to go and just see it on my own because I want to make sure that those videos are real.
Mm-hmm.
But I think at this point we can safely assume that they are legit. Do you have any specific plans to fight with drug-related crimes or the actual addiction issue in United States?
Yeah. So this is a hard topic. For many people within our state right now. Oftentimes, I don't think people realize how addiction is really ravaging many of our communities. And you are actually seeing this addiction, and you also see deaths of despair right now within our community as a whole. So I was telling someone not too long ago about how you have, people oftentimes think about gun deaths, and more people are killed through homicide by handguns and things of that nature. But to be quite honest, more people commit suicide by guns than actually are killed by guns. So you have more people committing suicide. We have more people committing suicide now. The numbers are continuously upticking. And we see that where people do not feel like they have hope, do not feel like there is reason to live, where they cannot provide for their families. You find this also, numbers are starting to creep up with our elderly population, those above 61, 62, 63, 64 years old, where issues coming of how am I going to provide for my retirement? I can't work anymore. How am I going to make my life happen for the next possibly 10, 20 years. There was a study by Axios that showed that more seniors are concerned about running out of money than death itself. And it was around 50% or more were more concerned about running out of money than death itself. And so it shows that there's this, the inflation that many of our community members and friends are dealing with is impacting us all, and not being able to provide for one's family, not being able to support one's children. If you have to work three jobs a day to provide for your child, but you're not able to be in the home with your child, it provides a gap. And then the next thing we're saying is, why aren't you with your kid? Why is your kid out here doing these things? And so there's a trickle effect of all of this when it comes from the economy to healthcare, to one's ability to get quality housing. And so for me, I think it's more comprehensive. How do we get more people working? One thing I believe is that at our country, our state is behind around 21,000 units when it comes to housing units, right? Mm-hmm. That would be the size of like Bear or Middletown, top 5 in the state, if it were a city itself. One thing, and then on a whole, the country, many people argue, is behind around 4 million to 6 million units as a nation. I think we need to be serious with this and have the federal government get off the sidelines, similar to in 1933, FDR, Franklin Roosevelt created the Civil Conservation Corps, and they paid men to go out in many areas throughout the country, New Mexico, West Virginia, Tennessee, to do work around infrastructure, building dams, bridges, infrastructure that our country very much needed. I think we need the infrastructure, but we definitely need the housing, and we need more people to have said skills so that they can provide for themselves and their family. So all these things come together in creating what is to be our nation as we move forward. I think we need to look at this from a comprehensive viewpoint, because it's not just drugs and addiction alone. It's attached to I'm unhoused. It's attached to I need mental health help, but I don't have the insurance to properly cover it. So all these things are tied together. It's not necessarily as much in a silo.
And also, we don't have enough medical resources, like providers, to deal with those issues as well. So it's just more than the financial. It's just, you know, primary care is dealing with the shortage, but when it goes to the psych-related specialties, it's very difficult to get into those programs. Now, I know all these difficult issues, it's going to require a lot of energy, time, expertise, but also you have to win the primaries so that you can go to the next level from there. And fundraising is important. Raising enough money is important. How are you doing with the fundraising?
Doing well. We had a kickoff about a month ago. It's a month and a day. And we had our kickoff. We had over 300 people in attendance, up and down the state. We were able to raise around $100,000 in the first 24 hours, which is a huge deal, huge haul. And we're just going to keep raising money. Campaigns come down to two things: people and money. And so money just helps you get tied in and connected to more people, essentially. It's all about people. So we're going to continue to go up and down the state, connecting with people, talking about the issues, raising money. If someone cares to donate, you can go to eugeneyoung.com to certainly make a donation in support of this message and what we're trying to do for the state. But I would also say these two things. One is the fact that in this process, you know, I'm an athlete by nature. I played basketball majority of my life, coached afterwards with the nonprofit. And I just believe in the fact that, one, we won't be outworked. We're just going to be very diligent and hardworking. You know, we're not going to worry about what others are doing. We're going to stay focused on our race and what we have to do to win. And second, we will have the most diverse campaign in this race. We will have people, and when I say diversity, I'm not just saying, oh, white, Black, Latino, Haitian, you know, that the normal demographic is what someone thinks of when they say diversity. I'm saying a diversity of geographic location. Even at our kickoff, we had people from the very bottom of the state in Selbyville and Laurel and Seaford to Claymont, from different socioeconomic statuses, from different professions, different walks of life, different faith. And that's what we're going to hang our hat on. My life has been about service and bringing people together. And that's what we're going to continue to do moving forward. So I'm very much excited, and undergirding all that is a sense of thankfulness. This is an opportunity of a lifetime, and I take it so seriously. I'm incredibly thankful for it.
And Eugene, we will include your campaign link in the event after we post the event, so that those who are watching, they can actually go to the link from there. And again, this was a very enjoyable conversation. I wish you well, and I do want to make sure that we can actually get you back in 2024 before the primaries and see how everything is going. And there's so many other things. I mean, if you see in front of my right now on my desk, I have like 10 other questions that I didn't ask.
Well, I will say this. I would say I would love to. I'd be honored to. And then also, you made a mention of coming to your office and you have a drink. You can have a drink. I'll drink some apple juice, and we can talk some other stuff as well.
Well, that would be great. That would be great. Well, thank you so much again for joining us, and we'll see you. We'll see you soon, and then our event will be back next week. And we do have our Bariatric Friday events which started in 2 minutes. So we'll see you guys soon, and thank you so much.
Thank you. The pleasure's all mine.